Hello everyone, today we'll be talking about arterial blood gases. So when we talk about arterial blood gases, blood gas analysis is a commonly used diagnostic tool to evaluate the partial pressures of gas in blood and the acid-base content. So a blood gas analysis, it can be performed on blood that is obtained from anywhere in the circulatory system, which can be an artery, a vein, or a capillary. However, when we talk about arterial blood gases, this explicitly tests blood taken from an artery. So the parameters that consist of an arterial blood gas panel include pH, which measures the acid-base balance of the blood, and the normal values are between 7.35 to 7.45. However, often we use a cut point of 7.4 to be the normal, and then below 7.4 to be acidic, and above 7.4 to be alkaline. Then partial pressure of oxygen, normal is 75 to 100 millimeters mercury. Partial pressure of carbon dioxide, which measures the thing, which normal range is 35 to 45 millimeters mercury. Bicarbonate, normal values are 22 to 26 milliequivalents per liter. Then base excess or deficit, which calculates the relative excess or deficit of base in the arterial blood. Then saturations of oxygen, which is calculated arterial oxygen saturation, for which the normal values are 95 to 100%. So how do you read an ABG? So the first thing you do is you look at the pH, okay? So we say that the normal values are 7.35 to 7.45. So that's the normal pH. Below 7.35 is acidemia, and above 7.45 is alkalemia. However, often some people say that, or some literature says 7.4 can be a cutoff point, and below 7.4 we call it acidemia, and above 7.4 alkalemia. Then check the partial pressure of carbon dioxide and bicarbonate. So to assess whether the acidosis or alkalosis is of metabolic or respiratory origin. So what does this mean? So when you look at the partial pressure of carbon dioxide and you notice that it's above 40 and a pH is less than 7.4. So the fact that carbon dioxide is high and pH is lower, so that's going to be respiratory acidosis. While when you look at the partial pressure of carbon dioxide, it's below 40 and pH is above 7.4, so that indicates a respiratory alkalosis. So we just look at this diagram. That's like a brief summary of what we have discussed. So if pH is low, partial pressure of carbon dioxide is high and bicarbonate is normal. So that is respiratory acidosis. If pH is high, partial pressure of carbon dioxide is low and bicarb is normal. That's respiratory alkalosis. Then if pH is low, partial pressure of carbon dioxide is normal and bicarb is low. That's metabolic acidosis. And if pH is high, partial pressure of carbon dioxide is normal and bicarbonate is high. So that is metabolic alkalosis. So we have an example here. An ABG which shows a reading of pH is 7.39. Partial pressure of carbon dioxide is at 51 millimeters mercury. Partial pressure of oxygen is 59 millimeters mercury. Bicarb is at 23 and saturation of oxygen is 90% on room air. Similarly, we look at the pH, which is 7.39. So we said 7.4 can be used as a cutoff. So when we look at 7.39, we think of acidemia, okay? Partial pressure of carbon dioxide is at 51 millimeters mercury, which is high. And then bicarb is 23, which is normal. So this is going to be, you can type down your answers in the comments. So this is most likely respiratory acidosis. And we move to example 2, where the pH is 7.45. Partial pressure of carbon dioxide is at 32 millimeters mercury. Partial pressure of oxygen is 138 millimeters mercury. Bicarb is at 24 milliequivalents per liter. Base deficit is 1 milliequivalents per liter, and saturation of oxygen is 92% on room air. So in this one, we start by looking at the pH, which is 7.45. So we know there is alkalosis here, okay? So there is alkalosis. Then we look at the partial pressure of carbon dioxide, which is 32. So 32 is lower than the normal, isn't it? Then bicarb is at 24 milliequivalents per liter, which is normal. So this is most likely respiratory alkalosis. This was my reference. Thank you for watching.